government is going to have to step up in a huge way to make sure working people in this country and people who aren't working but need money, people without much money, people who are already struggling, are taken care of. Here to talk about that, Richard Trumka, president of the AFL CIO, which represents more than 12.5 million working people. What are your conversations like inside the labor movement with your members about what you want to see happen in terms of both the workplace in dealing with this and then the federal response?
Well, our members have sort of been left in the lurch, Chris. This administration has made a series of blunders that have left us and workers holding the bag, if you will. When they first came in, there was an occupational disease, workplace standard occupational disease that was about to be passed. It would have required employers to have a plan, to educate their employees, and then have proper safety equipment online so that frontline people like hospital workers, EMTs, were protected. They scrapped that rule. And then immediately after that, this administration scrapped the rule that President Bush started when he had a pandemic disease coordination and infrastructure team. And President Obama built on that. He then scrapped that. OSHA, the Occupational Safety and Health Administration, that is supposed to protect our health and safety, has fewer inspectors and health specialists than they've ever had in their history, and they've been without a leader for 2 years. This administration, Chris, spent 12 times more on immigration enforcement than they did worker health and safety. So as a result of that, we've been left in the lurch, and we've had to train ourselves, and we've done that, and we've tried to help our members educate each other and get them the proper safety equipment. But we've sort of been left in the lurch. Today, by the way, the administration had a chance to change and correct the oversight when they did away with that occupational disease standard that OSHA was going to issue. And they fought and took it out of the bill today so that they put profit once more time in front of workers' health and safety. And we're angry about it.
So is there no uniform standard in terms of how management and bosses have to deal with making judgments about workplace safety in the midst of this pandemic?
There is not. There isn't any standard. There would have been. We would have had that, and they could have resurrected that today so that they had to file a plan, they had to educate their workers so that all workers knew, and they would be responsible for protecting the health and safety of their employees from contagious diseases. And they did away with it again today. This White House did that.
Wait, what you're saying is that provision, that regulatory provision, was in the original bill text that the House Democrats proposed, and the White House in negotiations was the one that struck that provision.
Exactly. And the Chamber of Commerce opposed sick days. They tried to get sick days, paid sick days, taken out of this bill. So the workers would have been left in the lurch. Look, what we said is we need free testing so that low-wage workers that can't afford the testing aren't dissuaded from getting tested. We need to be able to have paid health days. If you have days off, then you have to quarantine yourself. You have to be able to have the proper equipment that's out there. We wanted unemployment insurance expanded so that if it is a long-term unemployment, like the people that you were talking about at those arenas and other places that are going to get laid off, that they would be taken care of as well. We fought for those things, and a lot of them especially the workplace standard was taken out of the bill today.
Are you thinking about the scope of this in terms of the economic dislocation it might cause for your members and working people? I mean, you know, we don't know what the future is, and it could be that things are really disrupted for a few weeks, or it could be longer. And if it's longer, I mean, how are you thinking about what people are going to need to just basically survive?
Well, they're going to need health care, that's for sure. But there's also 3 or 4 other things that they're definitely going to need. We're looking at 4 or 5 different kinds of stimulus. We want to get money in the hands of the states through Medicaid so that they can help out. You need to get money in the hands of workers, and that could either be a lump sum like President Bush did, where he gave people $1,000 to spend, or it could be another form. And then you have regular infrastructure that's out there that needs to be taken care of anyway. That can help create jobs and then make money available for small businesses that are going to be hurt by all of this to make sure that they can get through this, so that we don't let workers are left paying the bag on two fronts. First, our health and safety is jeopardized because they're not giving us the proper standards and the proper equipment. The second thing is we get left behind economically. The other thing that this administration did, Chris, just this week, the CDC changed the standards, the health standards of the equipment that we use. You used to have a respirator type face mask if you were dealing with this disease. Now they've changed it to you just have to have the cloth masks, which everybody knows are ineffective when dealing with this virus. The second thing that they did this week was when you came in and you were a likely or a confirmed candidate with this virus, you had to be in an airborne isolation room. They did away with that. So now you can be in any room. You don't have to be in an airborne isolation room. And both of those things are going to cause this to spread more rapidly than it would have otherwise done.
I just want to make sure that I'm understanding. Are those regulations by the CDC, are those applying to hospitals, to points of medical care, or to workplaces?
They apply to everything. It's the guidelines from the CDC. They apply to hospitals. They apply to workplaces.
Right.
So they don't have to give you, the frontline people, particularly those that are on the front line, nurses, doctors, EMTs, those people, they used to have the respiratory type mask on. Now they just have to have a cloth mask or any kind of mask that we know doesn't stop the contraction of this virus.
Are you concerned about, obviously the National Nurses Union has been ringing the bell about this, and nurses particularly, which is a very strong militant union. Are you concerned about those frontline healthcare workers right now?
Absolutely, we're concerned. We're concerned because they changed the standards to weaken them. And then I can give you a number of stories. You had a doctor and several nurses that were exposed to the disease. They told the doctor and furloughed the doctor, and they never told the nurses. Those nurses continued to work and be exposed and interact with other patients. That's happening everywhere, and it's going to pay a price. Our members and frontline workers are going to contract this disease and in a manner that they never have to do if they were issued proper equipment and the proper safety precautions were taken. We're terribly frightened by that, and we don't think we should be exposed to that type of risk.
Right. Richard Trumka, president of the AFL CIO. Thank you for your time tonight, sir.
Thanks, Chris. Thanks for having me on.